This is Where We Live from Connecticut Public Radio. I'm Lucy Nalpathanchel, broadcasting remotely. Innovators are important now more than ever as the global health crisis continues. What can the U.S. do to improve innovation for the public good? Things like vaccine development and better access to the internet for everyone. Coming up Where We Live, we talk to Nisha Charya, a senior fellow at the Center for American Progress and a former senior advisor in the Obama administration. We also learn how events like pandemics can bolster private and public partnerships. We'll hear from Fiona Murray, Associate Dean of Innovation at the MIT Sloan School of Management and co-director of MIT's Innovation Initiative. First, we check in with State Senator Saud Anwar, who is a medical doctor on the front lines fighting COVID-19. He's also leaned on innovation as he and his colleagues work to save the lives of Connecticut residents. Dr. Anwar, welcome back to the show.
Thank you so much, Lucy. Thank you for having me.
When I say that you're a medical doctor, you specialize in lung disease and critical care at Manchester Memorial Hospital. As a state senator, you represent several towns, including East Hartford and Ellington, East Windsor, and South Windsor. But I imagine your days have been especially busy over the last month working in the ICU. Tell me about what you have experienced, what your colleagues have experienced helping people with COVID.
So Lucy, this is I've been in this specialty and working for the past 25 years, and I have not seen anything like this before. We have seen illnesses with multi-organ failure, with ARDS or acute respiratory distress syndrome, and severely compromised patients all these 25 years. But the significance and the severity and the number of patients is way out of any of our plans or thoughts. And while we are managing these, it's like it's the same story and bed after patient, and it's emotionally a huge toll, and then it's physically labor-intensive work as well. And I don't think we have been prepared to work in this capacity, but at the same time, I can tell you that all the healthcare workers are coming together, and we are working hard to have successes, and thankfully we are having more successes than we would have thought.
Well, when we think about success, that's a good thing, especially as we hear about this peak that we're reaching in Connecticut, I think this weekend or in the next week. And so when we think about the peak, again, peak number of COVID-19 positive cases as well as hospitalizations, are you worried about your particular health system's capacity, that you may be overwhelmed, or are you in good shape in terms of the medical devices like ventilators that you need?
So as of right now, our contingency plans are working, but we are 1 or 2 nursing home outbreaks away from challenges. So we are looking at it every single day. We are reassessing our current status. We are looking at the number of beds, the personnel, and the ventilators, all that is available to us. So we are assessing that literally every day, because any day, any moment, some things can change if there is an outbreak in a nursing home or in a community or a cluster that we may come across in our neighborhoods.
What about PPE? Again, this demand has skyrocketed in terms of hearing when we talk about innovation. How is your hospital system working with maybe suppliers in our state who don't normally provide some type of protective equipment to help you and your colleagues do the work?
So there's a number of different strategies which we are using. So we are actually, obviously, everybody's cleaning up their face shields. The N95 masks, we have had some donations, thankfully, recently that has helped us. But the existing N95, we are cleaning them up with ultraviolet light. In the end of the day, we put it for cleaning, and then the next day we pick them up. So we have identified our own strategies, own ways of surviving, if you will, and then keeping the healthcare workers safe. In the beginning, we were worried, and because it is a marathon, while we are fine at this point, I don't know around the next corner if we would have enough, and that's why we have to stay on top of our status and make sure we protect all of our healthcare workers.
Today, we're focusing on the role of innovation, especially to deal with this unprecedented crisis that not only our country faces, but across the globe. So, as a policymaker and a doctor, Dr. Anwar, tell us how you've leaned on innovation to help maybe expand ventilator capacity, if this peak worsens.
So Lucy, so as a physician, as a critical care doctor, we fight to the maximum that we can, and we are fighting with the patient's physiology, patient's pathology, in a manner that humanly we can do, and then we are probably the last stop anybody could have. With that in mind, we also are trained try not to give up as much as we can. So with that in mind, when you hear and you do the math, which is easy enough to do, that if 50% of your state or 70% of your state gets infected, and 5% of them are going to be in the intensive care unit, you know that the state at one point had 1,000 ventilators, and you're expecting 80,000 people to get sick. It doesn't add up. So as soon as I looked at some of the numbers, I said that I'm not going to have, as much as possible, not have anybody die on my watch, and fight for every single person. So this is something that has been tried, where you can actually have a splitter on the inhalation as well as on the exhalation side of the ventilator, where you can use one single ventilator to help multiple people breathe. And this is like a last resort. It's not a standard of care, but in a disaster, in a crisis, we don't follow the standard of care, because if you do, then you're probably giving up on far more people than you would otherwise. So with that in mind, I came up with this strategy. This was something that has been done before, so it's not anything that's a rocket science that I came up with. It was done before by another physician when we had the Las Vegas shooting, and then there was one emergency room that was managing many of those patients, so they were able to use a ventilator. But what we did was we had a 3D printing of the quad splitter, and then we split the splitter another time to be able to have 7 patients breathe on it. This is not real patients. This is actually artificial lungs, to see how the mechanics would work, whether we could have the ventilator be fooled into making sure it's giving breath to one person, but we actually use it for 7. And it worked for us. And we were able to look at the numbers, we were able to look at the assessment, and we felt that if we are up against a last resort, we could have something that would hopefully allow us to save more patients than we would otherwise.
That's really amazing. And when you worked this out and saw that it worked in this test again, you videotaped it. And has it gotten a lot of attention among other healthcare systems, that this is something in your toolbox, so to speak, if needed?
So, Lucy, it got more attention than we had anticipated. I think it went viral with millions of people across the world watching it. I have been in conversations with people literally in every part of the world around this possibility. It's very real for other parts of the world. The ratio of the ventilators that are available and the population that may be infected are completely different. And we have had hundreds of countries that have actually downloaded our 3D files that have been made free for anyone and everyone who wants to use this if they need to. And then my YouTube videos and my Facebook videos are being used to try and at least be prepared. And I'm having conversations with the lung specialists across the world to at least tell them how to be cautious when you do this, because it's not as simple as just attaching people. There's a very important aspects to be conscious of. And then we have hundreds of cities across the United States where they have been downloading our 3D files as well. So people are watching and then getting better preparation. I hope that we never have to use these, but if people want to, at least there's another tool in their back pocket.
So these designs are open source. When you say they're downloading these 3D files, they would need a 3D printer as well?
Correct. So it's open source, and people are going to various 3D printing sites to get them ready.
And you mentioned that these are being downloaded all around the world. Do you know if any other hospital systems in other countries have used this ventilator splitter?
No, I've not heard of anyone using it in real people, but I know that everybody is ready and I'm telling them this is not the standard of care. This is not you would manage patients, and a lot of people are more interested to make sure it's a backup, but they're also it's a disaster in many parts of the world every single day, rather than what we are facing right now. So they are looking at it from that perspective, and they are thinking of modifying it so they can use it on a regular basis, and that will need a little bit more work.
You're hearing on Zoom today State Senator Dr. Saud Anwar, who is a pulmonologist at Manchester Memorial Hospital. He's also a state senator representing several towns, including East Hartford, East Windsor, and South Windsor. When I mentioned that this video has gotten a lot of attention, you said it went viral. Al Jazeera even profiled not only this experiment that you put out there for people to see, again, as a last resort for ventilator capacity, but the community also wanted to show their support and thanks to you. They did a parade past your house. What did that feel like, Dr. Anwar?
That was I wasn't prepared for it. It was a big surprise. I had no clue what was happening, and I've been in quarantine. So because I'm taking care of all these COVID patients, so I actually am locked in a room, and I go to the ICU and then back in my room, and that's how my life is for the past over a month now. And as a result, it's like not interacting with humans in real form. And when I saw all of these people come out in front of my house, it was very emotional, and it was very kind of them. It had nothing to do with me. It's just their kindness that showed, which was heartwarming for me.
How's your family handling your quarantine and the work you're doing?
Oh, well, obviously we miss each other. You take for granted how much holding hands and hugging each other means. And then I can't wait for this to be over so I can hold my family and hug them, and probably won't let go for hours before I'm done.
Well, we thank you for joining us today on Where We Live, and thank you for the work that you're doing. Dr. Saud Anwar, also a state senator, a pulmonologist at the Manchester Memorial Hospital. Thanks for calling in today.
Thank you so much for having me.
This is Where We Live from Connecticut Public Radio. I'm Lucy Nalpathanchel. Coming up, how is Connecticut's manufacturing sector working to meet the needs of local healthcare workers during this pandemic? We talk with a nonprofit that's been matching local manufacturers to fill supply needs. Are you one of them? You can join us too. 888-720-9677. That's 888-720-WNPR. Or find us on Facebook and Twitter at Where We Live. This is Where We Live from Connecticut Public Radio. I'm Lucy Nalpathanchel, broadcasting remotely. We just heard from Dr. Saud Anwar, a state senator, about the need to rely on innovation during this pandemic. Local manufacturers can help with demand, but how do they get connected with the healthcare industry and their workers if they don't normally work with them and may not understand their needs? Joining us on the phone now is Mike Stimson, Director of Strategic Engagement and Process at Constep. He's been involved in setting up and executing the Connecticut COVID Response Program, which matches Connecticut manufacturers with healthcare providers. Mike, welcome to the show.
Good morning. Thank you for having me on.
When we think about this pandemic, we've heard policymakers talk about, again, what it's like when we're at war. And we know in Connecticut, we've got a strong manufacturing sector, definitely aerospace. There's also medical device production. So tell me about how your organization is working with local manufacturers who've had to shift to help meet this demand.
Sure. So Constep's a consulting company who specializes with working with small to medium-sized manufacturers to help them solve operational problems and improve their business. We're part of a nationwide network called the Manufacturers Extension Partnership, and that allows us to leverage expertise and other resources from across the country. So the challenge, as you alluded to, really is that the normal healthcare supply chain has been disrupted in a couple of fundamental ways. the usual suppliers have either shut down or are unable to import the needed supplies. And this is coupled with the fact, as Dr. Anwar mentioned earlier, that the demand has skyrocketed. So dozens of manufacturers have stepped up and have repurposed their operations to produce a variety of items. But the problem is, because these companies are not part of the normal supply chain and are not visible to healthcare providers and first responders, it's very hard for them to make those connections, as you mentioned. Mm-hmm. And they also have raw material operation and distribution challenges for which they are normally not set up to resolve. So we developed the Connecticut COVID Response.org website in an effort to tie the two groups together, the healthcare providers needing the PPE, as well as the manufacturers who have repurposed their operations. We did this in coordination with Colin Cooper, the state's chief manufacturing officer. And there's been some great examples of companies out there who have made this shift.
Give us some examples, Mike.
So there's a company down in West Haven called Thermax. Their normal business is to produce insulation covers for heating and cooling pipes. But they refocused their cutting and sewing operations to provide gowns made out of Tyvek house wrap. And they are donating these to first responders, and they have essentially been able to cover the needs of a majority of the first responders in the state by doing this. They partnered with local home builders associations to obtain some of the building supplies. They tie the house wrap itself. And then also, this was kind of interesting, to solve the logistics challenge of getting the supplies in and the finished products out, they partnered with AAA. And they're using their delivery service vehicles as the kind of the distribution method to provide the products out to the various towns.
That's really cool, Mike.
Yeah, it was.
So we've heard about the need for ventilators. You mentioned making these disposable gowns. Face shields are also something that first responders and healthcare workers need. Give us an idea again of some other companies that have stepped up and shifted what they normally produce to help. And are they getting any state financial help to shift that capacity?
Sure. So there are several companies on face shields, and that's probably one of the bigger success stories here. Many companies have shifted their production. A couple that come to mind are Curtis Packaging. We're able to shift their printing and packaging operations to be able to stamp out vast quantities of the disposable style of face shields. And Allied Printing is another one. In a similar vein, have utilized their printing and stamping capabilities to produce these more of the disposable variety of face shields, but also Webco Plastics in Middlefield. They are a injection molding plastics company who has some experience with the medical device community. But they took a part of their operation and set up a brand new face shield production line in conjunction with some advice from UConn and working with us to create a whole new line of products. You asked about the potential state funding that some of these companies are able to tap into. There's been an existing fund out there called the Manufacturers Voucher Program that the state has reallocated some of the funds to. I believe the number is about $1.3 million for companies to apply for grants that can be used to offset the cost, basically the capital costs, of refocusing their business towards the production of PPE and other needed medical supplies. It's been wildly successful. Many companies have already tapped into it, and quite frankly, some of them are already starting to receive their checks. So it's been a very efficient program that was able to be repurposed for this need.
Has that fund been tapped out, or is there still resources to help other small manufacturers?
It is it sounds like it's starting to get to to be oversubscribed at this point as far as the requests go. So I believe there's some work in play right now to see if that fund can be extended. The other sources of funding are essentially the ones that are out there today for other businesses too, such as the loans for payroll and things like that. But as of right now, I'm not aware of any other particular funds that are out there specific to this need.
You're hearing on the phone Mike Stimson here on Where We Live, Director of Strategic Engagement and Process at ConStep. He's been involved in setting up and executing the Connecticut COVID response program, which is matching Connecticut manufacturers with healthcare providers who need PPE. Mike, we've got a lot of bigger healthcare systems, but I'm thinking that local community health clinics and other organizations need this kind of equipment. Is there a way to pair these manufacturers with them as well?
Yes, there is. And so the website that I mentioned, the CTCOVIDresponse.org website, what we're doing with that is we're taking in information on manufacturers who are providing the services, but also for folks, those that you mentioned, smaller assisted living facilities, smaller community health centers. We're taking in their needs, and we're playing matchmaker, essentially. We're assessing what the needs are, determining if there is a manufacturer who has repurposed their operations that could meet that need, and then putting the two together, giving them their websites, their telephone numbers, and just matching them so they can order directly from these manufacturers.
And something that we should highlight, again, all of these, the shift from local manufacturers to make this type of equipment to help healthcare workers. They're not technically certified products for this particular need, but because there's such a demand, that's why there's this shift, and it's better than nothing, Mike, right?
That's exactly right. These products are not FDA certified, but the CDC has put out guidance that in the absence of products from the normal supply chain, items like these can be used if the healthcare provider deems them to be acceptable. So that's part of the matchmaking that has to happen also, is that samples of these products get out to the healthcare providers, they see them. And one of the things that we're able to do, and this has been working successfully with the Connecticut Hospital Association, is once one healthcare provider does accept it, we're able to leverage that to let others know that this has been accepted in other areas, and so they have some confidence that it's a product that will meet their needs.
Again, you're listening to Where We Live as we talk about the role of innovation during this pandemic. You can join our conversation, 888-720-WNPR. That's 888-720-9677, or find us on Facebook and Twitter at Where We Live. I wanted to bring into the conversation now on Zoom Fiona Murray, Associate Dean of Innovation at the MIT Sloan School of Management. She's also co-director of MIT's Innovation Initiative. Fiona, welcome to the show.
Thank you very much for having me on today. I appreciate it.
So talk about some of the innovation we've already discussed on the show, first with Dr. Anwar and now with Mike Stimson, again, helping small manufacturers who make things that may not be in the healthcare supply chain, but now they're stepping up to help because of the pandemic. Is this something that we're seeing across the country?
Yes, I think at this moment of crisis innovation, we're actually seeing everybody throughout the community, so throughout small communities, throughout states across the country, and in fact all over the world, are actually engaged in crisis innovation. I think what's different today than in normal times is that we're all really focused on connecting and converging our effort so that we can actually take all the extraordinary innovative ideas that people are having to try and solve these immense problems and really try to scale them to impact. You know, when I think about innovation, I think about it as taking ideas all the way from inception to impact, and impact means scale. And so that really does mean that we have to bring manufacturers together, we have to share blueprints, we have to be able to use distributed networks of 3D printers, and really everybody is part of this innovation, crisis innovation activity.
I've never thought about that phrase, crisis innovation, but looking back at history, there have been other crises in the past. Talk about how crisis innovation has, been dealt with in terms of what we've seen in the past pandemics, maybe even in the recession when supply chains and people making certain things weren't even able to operate.
Yeah. Well, we often talk about, at the moment, you'll hear people talk about us being on a war footing or, in a war. I think crisis innovation is something that happens when systems and communities are really under threat. And I think it does actually galvanize huge amounts of creativity and effort. And the really important thing that we have to do at these moments is make sure that we do get this convergence of effort. I think what's particularly interesting about what's happening today is that this is happening. Everybody's involved, all the way through from very, very young people, absolutely all the way through our entire community. It's also the case that I think in past moments of crisis innovation, it's often been about very, very large corporations who've sort of had to scale up production, whether during Second World War of, boats and tanks and what have you. Today, we're also seeing this very large network of small and medium-sized companies, and also the entrepreneurial startup community being incredibly important parts of the solution. So we're seeing these very nimble organizations, whether they are the sort of family businesses and the manufacturers that we were just talking about, or some of the startups that are coming out of places like MIT or in the Hartford innovation ecosystem, bringing solutions forward. And I think it's in places where we have these vibrant innovation ecosystems already and the sort of social fabric that we can start to push solutions into the system quickly. And that is an important part of what we're seeing today.
Mike Stimpson, I'm wondering if you can jump back in when we're listening to Fiona talk. We think about our big companies in our state, like UTC, Pratt and Whitney, and then when we were hearing from you talking about helping manufacturers shift to different capacity, are we seeing that same level of commitment and production?
Yes, I believe we are. So one of the things we're seeing, or there's a project working now with the UConn School of Engineering, is partnering with some fairly large aerospace companies on the design and the production of emergency use ventilators. Something that that Dr. Anwar had mentioned earlier. So I think we are starting to see essentially the supply chains of these large, well-established companies working to get into the fight, if you will, and help solve the issues that are coming up.
I'm actually broadcasting remotely from my house, so apologies if my signal dropped out there at the end, Mike. But Fiona Murray, going back to you on Zoom, when we talk about innovation in our region, I believe you've worked with Hartford Hospital on innovation projects. So talk through how, again, when you're working with a hospital system, how are they fostering innovation?
Yes, so I've been lucky enough to work with the Hartford healthcare system for a number of years since I got to know Dr. Barry Stein, who's their Chief Medical Innovation Officer. He was one of my students taking our executive MBA program up at MIT. And along with their CEO, Jeff Flax, they've made an enormous commitment to innovation in the hospital over the past several years. And for them, that's basically meant really trying to build a culture of experimentation, a shared language around innovation, a real willingness to try out new things, to bring ideas in quickly and safely, and then to scale them if they seem to be working, and then to shift if they don't. And also to find a way to dock in new startups, new academics who have interesting ideas. And I think it's because they had prepared and they have such fertile ground in the hospital over the last few years, and they've made that commitment, that when this moment of crisis comes, they're able to shift again into this rather rapid crisis innovation mode. And so we've seen them do some really important work around COVID analytics, which they've done in collaboration with one of my MIT colleagues and an enormous team of his PhD students. I think they've been able to shift to online health, seeing over 20,000 patients online. If you stepped back perhaps a year ago, many hospitals and healthcare systems have been talking about online health for a really long time. And it's been a very difficult thing to try and work out how to do. And all of a sudden, it's basically happening at scale, in part because we have to do it, but I think in part because we have this prepared fertile ground, and the hospital and Barry and his teams were really making this commitment to innovation over several years, which has allowed them to really have this incredible velocity of bringing ideas to scale rapidly right when we need them.
That's an important point, Fiona. I'm also wondering, though, in terms of when we think about encouraging innovation across our country, where some of the gaps remain so that we're not then responding when there is a crisis and it's all hands on deck?
So I think that we really do need a sustained commitment to research and development. And I think we need that across the board in a whole variety of areas. We've been very fortunate that in general, the federal government has had a very long-term commitment, actually ever since World War II, to really strengthening the science base. But I think we need to actually really continue STEM education. One of the gaps, I think, is probably in digital and sort of online literacy, coding, and so on. And we can see at a moment like this, we actually need to make sure everybody is able to be incredibly proficient with working online, existing online. We might not want to do this all the time because this is a very stressful way to live. But there are certainly gaps in terms of the underlying infrastructure, the real access to broadband and so on. I think we also do actually need to really focus. We've heard just now about manufacturing. While it may be very, very efficient to have global supply chains, we do definitely need to make sure that we have manufacturing capabilities that are really strong in this country. I think that's an important piece of the puzzle that we need to focus on.
Mike Stimson, in Connecticut, we hear that manufacturers are really struggling to find the workforce to do these particular jobs. Is that something that you're hearing even from small manufacturers as demand is increasing, having people capable, having certain skills to do the work?
Yeah, that's, prior to the this pandemic crisis hitting, that was probably the number one concern of most small and medium-sized manufacturers. And, there's several things that they can do from, really truly understanding what their actual capacity is and implementing many, techniques and tools to help train new folks who are not familiar with a manufacturing environment more effectively, to onboard them properly, and to utilize automation and other technologies to supplement the workforce that we have. It is a declining population of workers, so manufacturers have to be very nimble and innovative to solve this very real problem.
Well, I want to thank Mike Stimson for calling into the show today. Again, Director of Strategic Engagement and Process at consulting nonprofit Constep. He's been involved in setting up and executing the Connecticut COVID response program, which matches Connecticut manufacturers with healthcare providers. Mike, thanks again.
Thank you. Thank you for having me on.
On Zoom with us, she's going to stick around for the next segment, is Fiona Murray, Associate Dean of Innovation at the MIT Sloan School of Management, also co-director of MIT's Innovation Initiative. Coming up after the break, this is Where We Live. I'm Lucy Nalpathanchel. After the break, how can the U.S. encourage more innovation for the public good? You can join us too. Find us on Facebook and Twitter at Where We Live. This is Where We Live on Connecticut Public Radio. I'm Lucy Nalpathanchel, broadcasting remotely. Innovators are important now more than ever as the global health crisis continues. What can the U.S. do to improve innovation for the public good? Things like vaccine development and better access to the internet for everyone. Joining the conversation on Zoom now is Nish Acharya, contributor to Forbes, also senior fellow at the Center for American Progress. Nish, welcome to the show.
Thank you so much for having me.
When we think about innovation, Silicon Valley comes to mind. When we were talking with Fiona Murray earlier, where how all of us have been able to shift, or many of us have been able to shift now to working remotely, working online. Zoom is really having a moment. But when you wrote a column in Forbes recently, you talked about the fact that there are certain types of innovation we need to survive and get out of this pandemic, things like vaccine development. So walk us through how, again, we can encourage innovators, like, say, in the Silicon Valley, to focus on this stuff for public good.
Well, yeah, exactly. And I think there's a couple of different ways to think about this that I tried to highlight in the column in Forbes. And one was that there are certain products in society that are public goods, and they are things that the entire society needs. And there may or may not be a private sector Silicon Valley venture model for this. And that vaccines isn't exactly one of them. There's really not a lot of startups developing vaccines because the funding has typically been from insurance companies or federal government as to benefit society. You think about a flu vaccine. And then there's other areas like education technology where there's been funding at early stages, and there's lots of Boston and Connecticut and Silicon Valley startups working in it, but the scale up has been difficult. And so, the thing I was talking about was that there needs to be some broader thinking about what are those innovations. And I think we're in the middle of seeing so many in healthcare right now with vaccines, lower cost ventilators, different types of PPE, different types of preventive treatment for COVID-19. These are all things that in the short term, there certainly will be a big business opportunity, quote unquote. But in the long term, these are just things that society needs. And if there's not a business model, then the government should step in and ensure that they're adequately researched. So as Dr. Murray said, that sustained commitment to R&D, and then that there's a clear pathway to produce enough vaccines for us to have as a society, even if it's not the most profitable, and certainly not as profitable as a cancer drug or something like that. So the U.S. should invest in that research and innovation to find vaccines and treatments, but also ensure that we don't leave it entirely to the private sector if they haven't shown that they can scale it up quickly. And for that, I use education as the example, where there's tons of education startups, but we've found, all of us, as our kids are at home, that the solutions are inadequate. And so while there's been innovation in that space, the scale up is going to require some government support, some quick guidelines, whether it's state or federal level. And the government's really going to jump in and say, this is necessary, just as necessary as a classroom was 100 years ago. The ed tech infrastructure is important, and we're going to invest in it as a country. So that's what I was thinking about as the role of government and as a role of public goods and innovation.
I'm curious, when we think about government, innovation doesn't always come to mind, or thinking that government can be nimble. And so how do you get government to be more innovative and also attract talent that wants to work for the public sector and not the private sector, where they can make more money?
Right. And so I think that's sometimes a fair assumption, but I think in reality, I think the government has been very good in supporting R&D that's been done by private organizations or state universities. You think about UC Berkeley in Michigan, and as sort of state government, institutions, public sector institutions, but they do incredible research. And so I think, the government doing what it's doing now, which is supporting R&D, and we've seen this with vaccines, where they're giving a lot of government funding to private companies to develop a COVID-19 vaccine. And that's probably a good strategy. Where government, I think, needs to get better is the strategic planning around the pandemics, and thinking about the next pandemic so that we don't ramp up from zero again. And are we providing enough R&D funding for this is a coronavirus, COVID-19 is a version of the coronavirus. And so are we thinking about the next novel coronavirus, and are we ramping up the infrastructure to research that and treat it as it comes along? So I think that's where government really needs to think is how are we going to do that? How are we going to prepare and innovate for the next set of challenges and be ready for them? And that they can be good at when they want to be.
I was also thinking, Nisha, that everyone's waiting for this vaccine to deal with COVID-19, but when that vaccine is finally developed, does the government have the capacity to make sure they've got billions of doses?
Right, exactly. And so that's exactly where the scale up part of it comes in, that there may not be a business opportunity to build lots of manufacturing capacity and to produce 300 million doses of this vaccine, that it just may not be a business opportunity. And so that may be something where the government has to say, either through this Defense Production Act that the president is invoking, or government funding. The whole defense industry is built on this concept, right? There's no client in defense except for the federal government. And so we can do this. We can say, we need you to create a vaccine and then produce it, similar to what we do with fighter jets. And so I think that's where government needs to maybe learn from what it's done in other sectors and build it up. And I would add to that, broadband is another topic of that, where 5G is a technology that's been developed by private sector in America based on scientific funding from the U.S. government, but they're just rolling it out too slow. And maybe there's a role for the private government to say, hey, private sector, let's roll this 5G out. So God forbid this fall, we have to shut things down again. 5G is available across more of the country than it is now. And so the question is, who's going to do that? Are you going to get Verizon to do that? Or are we going to say everybody's got to do it because we need it as a country?
Yeah. Fiona Murray, I wanted to bring you back into the conversation again, Associate Dean of Innovation at the MIT Sloan School of Management. Talk through some of your views on, again, encouraging more of these public-private partnerships.
Mm-hmm. Yeah, thank you. I very much agree with a lot of what's just been said. What I will say is that there is no lack of commitment to really impact-oriented, mission-driven activities on the part of this young generation, whether they arrive at university on the West Coast, the East Coast, or anywhere in between. We see a tremendous commitment to wanting to have impact and really wanting to focus on some of these very big challenges. And I think there are a number of things that we need to continue to do and do better. I think the first is to make sure that our education is fit for purpose, so that in addition to giving people some of the really deep skills, technical skills, other sort of social science skills that they need, to also make sure that they actually understand the innovation process, they understand markets, and they also understand how to interact and interface with government. Because as we just heard, the government is often the biggest customer. Regulation is often something that you have to be part of and engage with. And so we really want to be able to have intelligent conversations and make sure our students are actually educated in that way. On the other hand, I think we also need to make sure that we continue this investment in R&D. As we heard, the fact that we actually do have around the world, and particularly here in the US, 70 or 80 different vaccine projects actually taking place right now, is in large part because there's been a pretty sustained commitment to some of the basic fundamental life sciences. We're going to, I think, need the same fundamental commitment to some of the other massive problems on the horizon, including climate change. We don't know where the next moment of crisis is going to come, whether it'll be a pandemic, whether it'll be in climate change. And so we really do need to continue that commitment. But I think the gap that we've just heard about, which is the scale up, is right, that the private sector, and particularly the sort of Silicon Valley style risk capital, was completely optimized for things that were quite quick to scale and very inexpensive. So software is cheap to scale, it's expensive to develop, but once you got it, you can share millions and billions of copies of it. That's not true of a vaccine, that's not true of an energy storage system. And so this funding for scale, I think, is a really key point that we have to focus on. I think that's going to require a combination of sort of public-private activities. We're probably going to have to look to philanthropists as well for some of this, and we're going to look to new sorts of models. There's some very interesting new impact investing kinds of models. And I really like this idea of reminding ourselves that, the government needs to actually be nimble in its procurement. There was reference made to the Department of Defense and the Pentagon, right? In defense, they absolutely are the customer, and they are what drives the incentive to produce, the next aircraft carrier or whatever it might be. But we really need to be more nimble, I think, in our procurement so that we can get our ideas pulled through to scale in these new ways. So that puts quite a lot of pressure on the government to think about its procurement and about regulatory flexibility and new funding models.
When we think about funding, go back to Nisha Charya, the government funded by tax dollars, but people don't want to see their taxes go up. And so that sometimes can be a challenge if governments aren't resourced well enough to be innovating.
Right. So I think that's the biggest challenge we're going to be facing in the next few years is government resources. I think, and this question of whether it goes to, I think vaccines and prevention, I think there's general agreement we need to do that. But when you get to some of these other issues like education, technology, or broadband, I think that's a valid discussion as to whether it goes directly to small businesses and taxpayers as relief, or you're investing in these things. It looks like right now Washington is willing to, debt is cheap, and Washington is willing to, use that to its advantage and pass big stimuluses. So I think, in that context, there appears to be funding for it. In the long term, obviously, we'll have to look at a couple of different options. If the private sector steps up, I think impact investing and philanthropy, as Dr. Murray said, is an area that with a lot of potential. It's to date, it's unrealized potential. But if those sectors step up, I think unrealized to their capacity. If they step up, then maybe a little less government funding is needed, and then maybe there does need to be some sort of change to our tax code, whether it's a wealth tax or returning the corporate tax, or some sort of different structure around R&D. I think we will have to think creatively about solutions to make sure that money is there. And again, I talk about three specific ones. One was vaccines and prevention or treatment. The other was ed tech, and third was broadband. And I think you could make the case that those three are all mission critical at this stage in our country.
Fiona Murray, you again are Associate Dean at MIT. Do you find that students there are thinking about the public good versus heading off to the private sector?
They are absolutely thinking about the public good. They're very mission driven, but that often means that they are heading off to the private sector, but they are looking for jobs where they can have impact quickly. Mm-hmm. Many more of them are heading into startups because they're absolutely sure that through startups who can be very nimble and agile, they can actually start to move their ideas forward much more rapidly. I think they do it in a quite, open-eyed way, knowing that they're then going to have to engage with the government, with large corporations. They seem to have a real willingness to do that because they know that it's really only in these kinds of quite complex but robust partnerships that they can have the impact that they want. But I think there's a real view that the private sector in effective partnership with different public sector organizations is really the solution and the kinds of solutions we need to put into place. So I think our students are really excited about working on these big challenges. Nish outlined a number of them. We see them, if we have a hackathon or any other event around something that does have this mission critical element to it, as we did with our COVID-19 challenge, we had 4,500 applicants for 1,500 places for the event that we ran on April the 3rd. And so you absolutely see a sort of a call to action. But a lot of that is then going to be expressed in students wanting private sector jobs in startups, where they want to grow and scale those startups in effective ways with the government, which is why I think we come back to the government making sure it's a really good partner. And whether it's through challenges, advanced market commitments, nimble procurement, I think we really do have to come up with these novel ways of engaging to make sure we pull those mission critical solutions through for the benefit of all of our society. Because I think especially in the wake of this crisis, and when we move, I hope, from crisis to calm, there really is going to be continued and massive dislocation and inequality. And these mission critical projects have to also take that into account and make sure that everybody can be part of the innovation economy going forward.
That's a good point to end on. Fiona Murray, Associate Dean of Innovation at the MIT Sloan School of Management, also co-director of MIT's Innovation Initiative. Fiona, thank you for joining us today.
My pleasure. Thank you for having me on.
Also with us on Zoom, Nisha Charya, again, contributor to Forbes, a senior fellow at the Center for American Progress. Nisha, we make sure we'll tweet out some of the links to some of the articles you write for Forbes. We appreciate your time.
Thank you so much, Lucy, and good luck with the show.
Thank you. Today's show produced by Carmen Baskoff. Our technical producer is Kat Pastor. You can learn more about the show. Just download Where We Live on your favorite podcast app. Tomorrow, we're going to take a little bit of a break and focus on something that might bring you joy, and that's gardening. I'm Lucy Nalpathanchel. Thanks for listening.